I feel like the transition between, pediatric asthma patient and adult asthma patient can be a little nebulous. And these are people who 2 months ago were teenagers, and now they're left to navigate a medical system. So I feel like there could be more support in transitioning into adult care, to help, because I'm sure, Jamari was busy and full of life and acting and dancing and all of that. And, had he maybe had a doctor who was a little bit more vigilant or a little bit more, firm and in him, taking his asthma care seriously, I think that could have gone a long way. I'm thinking like we have so much technology at our fingertips that I think, having more streamlined care, perhaps using patient records to better inform healthcare professionals. We would show up at emergency rooms and he would have really bad shortness of breath, and we'd be waiting like 6 to 7 hours to see a doctor. And perhaps if there was like a tab in his file that just showed how severe his asthma had been over the years, they perhaps would have taken it more seriously and got him seen. And I do think that that sort of, um, those healthcare wait times ended up being, a detractor from him seeking out care. Like, um, if we weren't waiting 6 to 7 hours in emergency rooms, maybe he would have gone 2 or 3 days before the asthma attack, was so severe. So yeah, just, more streamlined care and maybe better triage.